Give me a second. We are just getting together. Hey, we are there. Hey, everyone. Thank you for joining us for this community session on Thursday. Hey. Welcome. I thought my tea was hot and it is not, so I don't know what to say. It's also wind down time in my household, so in case you see some children roaming, it is because it is almost wind down and bedtime here in my household, in my good household. But thank you all for joining us tonight on this Thursday. I don't even know where to start. Like, we have so many things coming up for this quarter. And I wanted to use this space, one, to have a conversation about some of the spaces that we are trying to create with intentionality for 2024, and then also talk about one of the latest kind of one of the latest podcasts that I came across, and the revelations that I had from it, or I'll say revelations. I don't know if that is the best word for it, but it definitely was an experience. So first off, I just wanted to share that our newsletter for Black Girl Health Collective is going to be coming out soon. We're going to be trying to have a monthly newsletter so that everyone that is subscribed to our newsletter knows exactly what's happening and what our offerings are. We know that there are a lot of good programming that is happening out there with different orgs. So we want to be able to also amplify that and then also share what we have coming up. What I'm really excited about in the next week is that we are going to have a special community session called the Founders Table, where I'll actually be on with Shanae Darby, the founder of Black Mothers in Power, and also with Erica Allen, who is the founder of Do Care Doula Foundation. Now, both of these women are like amazing. They're like rock stars in the doula world within Delaware. Like, they're just rock stars in general, but within Delaware, like, they have been really, ingrained into the work of moving doula care forward to be covered for reimbursement by Medicaid. And they both just recently opened centers, community centers. So the Black Mothers and Power Center is in Wilmington, Delaware, and the Growth Family Resource Center just opened in Dover, Delaware. So those are really two Black-led organizations that are offering resources to the community and are actually doing the work. They're not just talking about the work, they're doing it. And they also offer training programs for doulas. So if that's something that you're interested in, make sure that you listen to our conversation. Hey, Cami, you good? Okay. Make sure you listen to the conversation next week because it's definitely going to be interesting and a good time, because, we always like to have a good time. So after that interview or founders table that we have next week, we do have a brunch coming up at iPad A in Washington, D.C. on February 10th. So make sure you are signed up for tickets. If you can't make the event, please feel free to donate so that we can continue expanding our reach and doing work and making sure that we're amplifying and centering our voices. And that's what it's all about. We not only want to create spaces to have fun and make beneficial connections, but we want to make sure that we're centering our voices in the space of health and wellness, and that people realize, like, when you are in a room with a provider, there are two experts in that space. The provider with their expertise as a clinical person, and they have the most up-to-date resources in that space. And then also you're an expert in your own lived experience, and that should be respected because that absolutely impacts your care. So stay tuned. We have more opportunities. We also, after Valentine's Day and the brunch, we are going to be rolling out one of our highly highly, I don't know, highly anticipated. I'll say highly anticipated sessions. And if you did not come to Black Girl Health Con 2023 in November, you like nothing can be like there. I can't even express what you missed, okay? Because it was an amazing time. But one of the most attended sessions of that day was the lace workshop. And the lace workshop is liberated, empowered, liberated, aware, connected, and empowered, led by the magnificent Corey Rorora. And when I tell you that the girls came out of it chattering and asking for every resource that she offered, it was a thing, and it is still a thing. People are still asking for those resources. So we are absolutely going to do it again. Corey has agreed to provide and do a 3-part series. So that will be starting in February. And if you don't know what it is about, let me tell you a little bit about what the LACE series is about. All right. So the LACE series pretty delves delves into all things human sexuality. There's conversations about safer sex practices. There are also conversations about BDSM and kink. Um, and listen, it was a time, and I'm actually going to attend because I was busy that day, so I didn't get to, to hear all of the tea and all of the things. So I missed out, and I definitely want to partake this time, because when I say that we are still printing out resources from that day, we are still printing out resources from that day. So because there are requests for them. So stay tuned for that. The tickets or the sign up list for that will be coming out soon. And I think those are all the major things that we have coming up. There is one plug. We do have a network that is coming out, but I'm not going to talk too much about that. So make sure you're signed up for the newsletter to hear more about that. But thank you for joining our community session. Oh, I saw a message in the chat. The brunch is in DC. This on February 10th, the brunch is in DC. We do have, it is catered. We have a bartender that is going to attend and we have a signature drink. We have cocktails and mocktails. I'm inquiring about with the caterer about the vegan on regarding accommodations for the vegan girlies. So more to come on that, but we definitely want to make sure those of you that are vegan are taken care of if that's a question. But you can always feel free to reach out to our email at admin@blackgirlhealthcollective.org. All right. And if you haven't looked up the iPad A, it is a black owned space in the heart of Washington, D.C. It is a beautiful location. It's a beautiful space. So if you're like, I want to come with my girlfriends and do a photo op, it is the space for that. If you want to have a good time, we're going to have music, food, drinks. I mean, what more can you, it's a great way to start off your 2024. So make sure that you get your tickets. So today I wanted to talk a little bit about what I came across or what I've recently listened to as far as like healthcare and reflecting on like where we are in this country. And I don't know if you all do it, but I'm a big fan of podcasts. I will listen to podcasts all the time. I mean, it seemed like everybody had a podcast. I mean, especially when we were in COVID. And I'm constantly sharing podcasts. I know my mom is sick of me because I know I send her podcasts. I send family members podcasts. So that's a thing for me. And one of the most recent podcasts that I came across was called The Retrievals. And I'm not sure if any of you all have heard about it or heard of the podcast called Retrievals or heard of the story. So essentially, the Retrievals is a podcast. It's a true podcast. It's not like I don't think they tried to premise it as a true crime podcast, but it is about a crime happening. And essentially, it's based in Connecticut. Now, if anyone is from Connecticut, they know that Yale is a school and also a health system. It's a massive, massive organization, or maybe I shouldn't say it up here because, well, I mean, it's yeah, no, it's a massive organization, and they've been named in the podcast. But a huge organization and a huge network, that a health system that has a large footprint in the state of Connecticut. And the story kind of revolved, or the experience revolved around their fertility clinic. Um, and if you know Yale is, or in the New Haven, it's I would say a very affluent community. It's Connecticut. It can be, it is diverse, but then it is a lot of white people in the space and in the city, especially, regarding Yale. And the story revolved around a fertility clinic there, and how how it came out that one of the nurses was actually stealing fentanyl from the patients as they were getting their eggs retrieved for fertility treatment. So what occurred was that these women and or patients would be laying down and be set up for their egg retrieval, and were supposed to get fentanyl to essentially kind of control their pain, and almost put them in like a kind of like twilight space, so that they really didn't feel the pain of their eggs being retrieved, which is a very, very, very painful experience. And it turned out that the nurse that was attending was actually swapping out the fentanyl for saline. So they never received the pain medication. A lot of the women had excruciating pain. They were, hopping up off the table. They were saying that, I'm awake. I can feel everything. I shouldn't be feeling anything. They were crying. They were being discharged and then readmitted to hospitals later because of their pain levels. And they essentially just weren't believed. Um, and it all came to a head when I would say, when a vial was noticed to have a loose cap, and essentially the nurse came in, and that was stealing the fentanyl with about, I don't know, it could have been maybe 100 empty vials of fentanyl. 100, like it was a lot. It was a lot of vials of fentanyl that she had stolen. And essentially, she was she came forward and said that she had started stealing fentanyl during COVID. And the podcast gets really deep and talks about like all of the it really does a good job of giving all of the different perspectives, and of not just the patients, but like this assessing the situation, or not even assessing, but giving information regarding the nurse and what may have influenced her to show up and do the things that she did. It also has actual interviews with the women and the patients that were affected. So it really gives kind of like a 360 view of everything that occurred. So it was a very like powerful podcast. But what stuck out to me most of all was this kind of section of the podcast where they were talking about the level of care for a provider, and whether or not it equates to women and or pain levels, and whether women or patients are believed regarding their pain levels. And if a patient or a woman has uncontrolled pain, but the doctor still feels like they are providing the level of appropriate care for that pain. Like, do we believe women? Or should a level of women's level of pain be an indicator of um, the appropriate level of care? And I know all of you are thinking like, absolutely, like how is that not a thing? But let me tell you, it's a thing. It's a thing. So basically, it doesn't matter if you're in excruciating pain. It doesn't matter if you go to the hospital and you're like, I'm not feeling good. I'm having, these pains in my body. If the doctor thinks that, you may just have anxiety, an appropriate course of treatment is to send you home, that's okay. Like, that's okay. And even if you could be having a heart attack. So it was a really interesting podcast to listen to. I've personally known people that have been affected by doctors not believing them or not believing their level of care. So it's so wild to think that you could go to a doctor and that you could complain and that you could say that this is a thing and there's an issue here, and one, nothing be done, or you not be believed, and there be no recourse for that. And essentially, in situations like that, there is no recourse, and that is the system that we exist in. So the bad news is that that is a thing. The good news is that we are focused on amplifying our voices and making sure that you, myself, our community, we all feel empowered to like navigate conversations with providers and be like, no, it's not okay, and you're going to listen to me, right? Because we're these are not just like, we are human, these are our lives, and we deserve the appropriate level of care and to be believed regardless of what Dr. Jackie said. Okay, Kami, I see you looking. What are your thoughts?
Well, considering that has been an experience that I've had quite personally myself,
Mm-hmm.
um, having gone to the doctor, primary care physician, complained of discomfort, of pain, went to the doctor. They looked, kind of said, that's interesting. Okay, I'm going to give you some antibiotics and some pain meds and come back and see me in 2 weeks. So 1 week in, I realized that what was happening wasn't getting any improvement. It wasn't getting any better. So I had girlfriends saying, this isn't right. You need to go to the emergency room. I was like, no, it might have to get worse before it gets better. All of the nonsense, to avoid having to go to the hospital, considering I had already spoken with my primary care and gone and received treatment for what it was. So after that, I called after the doctor on call after a week, and I said, look, this is heavy COVID. We're in the throes of COVID. Hey, I have pictures. I can show you the pictures. We can do this whole telemed thing because it's not getting any better. And I was told no, that I needed to be seen, and needed to be seen the next day, which was a Monday, I would say, needed to be seen because they weren't listening. I was like, this isn't getting better. I'm really in discomfort. The pain meds, nothing's working. No, we need to see you. But I don't understand why. It's COVID. Most people are doing telemed. However, fast forward the next day, 24 hours later, I was septic. Rushed to the hospital and woke up from rushed to the hospital, my local hospital. When I woke up, I was in ICU in Christiana Hospital, which is in Delaware, which is about an hour away from where I live. Simply because I'm telling you, hey, this is going on. You're not listening. I'm in pain, I'm in discomfort. And it's just what I realized through the entire process, because I don't want to make a long story longer, is that as a woman of color, you really aren't, I don't think it's what I heard, what my experience was. Wow, you must really have a high tolerance for pain. I don't know how to take that. I know I'm in pain and I need something for this pain, because once I'm released out of ICU, I'm in a regular room now. I'm complaining about pain, what's your pain level? And through the entire experience, what I learned was I learned how to advocate for myself. Instead of just taking what I'm being told or I asked more questions. Um, I spoke up more. I didn't allow just what they said, and I did not discount my experiences, what my lived experience. I'm that expert. So I was more adamant and more direct and more intentional about how I spoke up regarding my care. So once that began, they realized that they had to respect my points and how I was speaking up for myself. And I realized as a result of just that mindset switch and change is that I started to be heard more, and they realized that I wasn't going to take it laying down, pardon the pun. So I realized at that moment. So from that experience, I think that's when I started to listen to the whole mission and vision of Black Girl Health Collective, because it was my lived experience for a while. I dealt with that for, I think my final procedure was last year, March of last year. And it began in 2021. So a 2-year process, and having to go through all of that with teams of doctors, and having to speak up and be adamant about my care and my health, because I am a commodity and I am worth that. So I listened. I remember one instance where I was in the hospital room and I could hear the nurses bustling around, and there was a young lady that was in the room with me, and she's having a procedure done, and she was actually in healthcare. I think she worked for the health system, and she was in the hospital of the health system of which she worked. And I'm there and I'm suffering, and I'm asking this particular nurse, when is it time for my pain meds, because I'm in pain and I need something. And she clearly told me, no, you're not due for another 2 hours. And I know it had been 2 hours already. But she skirted past me and went to this young lady that apparently worked for the health system and said, do you need anything? Whatever you need, I know, because we have to look out for our own. And I'm hearing all of it while I'm laying there in pain. And I realized at that moment, yeah, life ain't fair, but it's okay, because I'm going to learn how to speak up. I will not be in this position again. And that's when I determined that, yeah, something has to be done. So those of you who are listening to this story, there's a whole lot more to the story, but like I said, I don't want to make a long story longer. But I need for you to understand just how important it is. If this has not affected you in some way, or you have not been affected some way in the healthcare system and this disparities in any way, there's going to be someone or yourself at some point in time where you're going to see it for what it is. And for those of you that are in healthcare, and you need to be that ally. You need to be that person, that ally. And I know it's hard when you're working in a system where you can clearly see what the disparity is and the unfairness of it. But you have to be able to find a place in and stand it flat footed in that space and be an advocate for your patients. So that's what I have to say regarding that.
I'm getting like chills because it just seems like yesterday, because I remember that time. And what I want to say, like what you said completely rings true to me, and what I've been like, I feel like I've been preaching or saying for the longest, is that like, one, you don't know unless you know how to navigate healthcare systems, and two, there will be a time, if it's not you but somebody that you know and care about, will need support and advocacy in that space.
Well,
And
can I
ultimately, the
add something? Can I add
yeah,
something right there? That's really
absolutely.
funny. That's really funny. Okay, so the last procedure, like I said, was March of 2023. I was in the room with a young lady who was having some things, some procedures done, and I found myself after having learned how to navigate and how to advocate and speak up regarding my health care. I found myself coaching her on what to say to the providers in the hospital. And I'm like, wow, this is hilarious. So, you know how you reach one, teach one? That's what this is all about, because it's a sisterhood, it's a movement, and we need to know that even though we're not being affected, but I feel like I'm a firm believer that me going through what I went through was not just for me, but it's also to teach and help my sisters along the way. So if I get that information to you, even if it's not you, and so on, you can share that with someone else, and go on. Because the reality is that the history of Black women in healthcare, it goes far beyond 2021 when Cami was affected. It's a history of the disparity. We were used to father of gynecology. He's labeled the father of gynecology. Since we're talking about reproductive health, the father of gynecology used enslaved women for experiments without any anesthesia, no pain meds. That's where some of this narrative and falsity of women of color having a higher level of pain, of a higher level of pain, and that's simply not true. But that comes from a historical narrative that says that, and it's not true whatsoever. And so, because of the fathers of gynecology's research, that mindset was passed down from healthcare generation to healthcare generation. And here we are in 2024, and we're fighting against that same narrative and disparity. At what point are we going to just take control of this narrative and change it? Because it's up to us. It's up to us. We have to be in that space saying, no, we're not taking this anymore. We saw what you did, and we're not going to allow that to continue.
We saw what you did. We
We
have
saw
to
what you
be
did.
right. We have to be our own watchdogs. Um,
Right, exactly.
and we have to, like, it makes me think about, well, one, it was, you just said a word, so I would just want to pause and just acknowledge that you said a word, um because that is the same perception to this day, that
To this day,
Black women have a lower threshold for or have a higher threshold for
like
pain,
for
like
pain.
we can take a lot, you know what I mean? But that also gets wrapped into the narrative of like the strong Black women, etc., which we know is completely false. But what that brings up for me is, one, if you all don't know, let me come close and let me learn you real quick. Make sure you follow Michelle Browder. She is an activist and artist. She has designed a monument to Anarcha, Lucy, and Betsy, the three women that were enslaved and experimented on by J. Marion Sims, the quote unquote
Father of
fraud,
gynecology.
fraud father of gynecology.
Right.
And she has really like transformed, like she's really focusing on transformative work in that space, and amplifying the experience, and taking the focus off of J. Marion Sims and putting it, as it should be, on the actual Black enslaved people that were affected, and that is really, really critical work. But like
And the
the
monument is located in.
Oh, I'm sorry. The monument is located, if you haven't looked it up, the monument is located in Montgomery, Alabama. She's actually having a conference coming up soon. So if you have capacity and you're near or you're interested in learning more, please look up her social media. It's called Anarcha Lucy and Betsy. There is an Instagram for it. She was also a keynote at Black Girl Health Con 2023. She is an amazing artist, speaker. She's just all around. She's got the juice, as
Absolutely.
Tasha would say. Um, but what this makes me think about is like advocacy and how we are doing the work to kind of well, not kind of, but to amplify and center our voices in the space of health and wellness, and how you all might like I feel like I'm getting to an age, and I'm sure a lot of our followers feel the same, where you get to a certain age where you begin to have to kind of, I don't want to say caretake for your relatives, but kind of like watch out for them. And I feel like I've been in that space like for years now, of where I'm like, no, you need to do this. This is what you need to do. Like if you don't like that and that doesn't sound clear, this is what I want you to do. And if they don't feel comfortable doing it, guess who's going to do it? I'm going to do it. Because that's we're not gonna we're not gonna go and exist in a space where you don't feel comfortable or you don't feel confident in your plan of care. That's just not gonna happen. And I say that for anybody. Like, if you do not feel confident in your plan of care, if you do not feel confident in your provider, talk to someone. We have to start building a network of communication, support, sharing stories and lived experiences. There are a lot of silos and individual experiences, and people are suffering alone. And I truly believe in the healing power of like community, period. That's it. I could say more, but period. I believe in the healing power of community and shared experiences. I think that we can never wait for a system to be able to save us. And I think that we absolutely have to invest in focus and save ourselves. And what that looks like is what it's always looked like for us. I think about the like thinking about the first Black doctor. I think if you listen to the 1619 podcast, they talk about how there was a whole book created for Black families because we couldn't get care in hospitals or the care was inadequate. So one of the first Black doctors actually developed a book that told the community how to care for themselves and how to care for their families. And I absolutely think that that is the space that we are in and that we will continue to be headed towards, because people often have the misconception that we have the best healthcare system in the world, and it's just not true. And who suffers and is impacted the most, it is our communities. So how do we combat that? So
You know, one thing that rings that I think was dev well, I don't want to say devastating, but it was such a shocker because even though I believe that the numbers, correct me if I'm wrong, that the numbers on average for a primary care physician, what's the national average of a primary care physician to one patient? Well,
um
patient to primary care patient.
so I would say, I don't quote me on this, but I think the last
Okay.
time I checked that the national average was about, I'll say at most maybe 1,500 to one provider, 1,500 PC excuse me. I would say at most, but I really think it's about 1,200. twelve
Okay.
hundred patients to one primary care provider. That's the national, approximately
Okay.
the national
So
average.
in the area that we are, just just a little tidbit of information, which was a shocker to me, and I think the numbers were somewhere around here. For this particular county, I don't know where you're located, but we're talking about Delaware and we're talking about Kent County. We're talking about a total of 2,200 patients to one primary care physician. Would that be closely accurate?
That is,
Okay, so at that point, ladies and gentlemen, bros, bros and sis, and listen, what type of care or quality of care do you think that you're getting with numbers like that? So therefore, if those are the numbers, and the national average is about 1,000 less, so that's a little bit better. But in most areas, because we're considered a rural community, so in areas like this, the quality of care is even less because we don't have the technology, we don't have the providers, we don't have the specialists. So if you're coming out with these ailments that require more, you're not going to get more. And so then if you're in a community that's already an overlooked community, how much more do you think you're going to get? You're just not. So it is up to us to take the bull by the horns and say, look, hello, look at me. I'm Sandra D. That's an old thing. But something needs to be done at this point because we cannot continue in this vein. We just cannot. And at this point in time, at this juncture, this is going to affect all of us. If it affects one, it affects us all. And that's just the reality of where we are. Sorry, go ahead. I just had to bring that
no,
up.
I mean, it's all connected, and it's true.
That's
One of
true.
the things that I realized when I moved back home from Connecticut and I was looking for a primary care provider, I had had a really positive experience with a black primary care, a black woman primary care provider in my city. And I called my old doctor's office once I moved back, and they were like, "Hey, she's not here anymore." And I was like, "Okay, great. Where is she?" And also, how long is it, like, when can I make an appointment or get an appointment as a new patient? And they weren't accepting new patients at the time. So then I went to go call the provider that I had had a really good experience with, and she had a year wait. There was a wait list. They She didn't have any appointments for over a year.
But
And
weren't you
that
traveling back and forth to Connecticut for appointments just to see this provider
No, no, no. This
after you had
I
moved back? No.
So what happened was is that because I could not find a primary care provider within the state, I had to, in a timely manner, I had to travel back and forth to Connecticut to see my old primary care provider because I could not get an appointment. Um Also, like, thinking about the wait list, and thinking, and technically we're not even, honestly, in Delaware or Dover, it's not even considered rural, I would say, um according to whatever, you know classification, whatever ridiculous
Okay.
classifications,
Right.
the government decides. But it
Right.
absolutely is rural. And, like, I think about how technology is advancing, and how during COVID we were able to make so many connections, and really build community. And I think about how we can flip that on its head and utilize it in a way that people feel supported and are able to have the tools and resources to not only advocate for themselves, but also just understand all of the different things about prevention, all of the different things about navigating systems, all of the different things about, hey, guess what, you're not in this alone, and you're not having an isolated experience by yourself. There are plenty of other people in our community that are experiencing the same thing, and let us be a support to each other, because often we as a community can suffer in silence, and that is not what we want. We want to make sure that we're building a community that is a safe space where people feel supported. So I could feel like I could talk about this forever.
Well, the great thing is that that's because it's a passion. It's a passion project, and it's because you are such an advocate for community and for awareness regarding healthcare, regarding women of color, and basically that's it. Because of this being a passion project, that is where you strive to educate, advocate, and all of the things. So it's important work. There's no way to downplay.
Mhm.
It's important work that has to be pushed forward. And the way to do that is by creating that space or those spaces as because we want to move as a unit. We're not doing this individually. We're a unit. We want to be a force to be reckoned with, where they can't just brush by us and say, let me make sure you're okay. I'll get to her later. No, you have to take notice of what I'm laying down right now. And you have to hear what I'm saying. Now, let's bring up Dr. Jackie for just a second. Now, I watch Married to Medicine. That is one of my, it's a decompression kind of thing to watch reality TV. Sometimes, not all. However, I was watching the episode where Dr. Jackie was so thrilled, because she was like, I have arrived. I get to talk to the Vice President of the United States regarding Black women and infant mortality and the mortality rate amongst Black women. So I watched the episode where she's sitting there having this conversation with Vice President Harris and all of the things.
I
It
think you
was a
called
great
me. You
photo op.
paused it. I think you actually paused it and called me so that I could also over the phone witness this interaction with the vice president via a video call.
But what made me upset mostly about that episode was the fact that they used this as a photo op when this is a real life epidemic. So to me, when you put it in that scope, it almost cheapened the fact that this is for real. You're more up to me. You're more talking about, I have arrived. I'm going to talk to the Vice President of the United States. But we're talking about life and death here. We're talking about life and death. And why is that? What are the factors that determine that our infant mortality rate is higher? Why? What are the contributing factors? The disparity
Racism.
in healthcare? But of course.
Racism.
Of course. I mean, it's racism, but you know what? I can't say that. It's a family show. But we want to skirt around the issue of what it really is. It's racism, plain and simple. It is what it is. So
It's
to
race.
sit and say that that's not what it is, no, that's not what it is. It's got to do something with economics. That may play a part, but the root and the heart of it is plain and simple racism.
It's
That's all.
racism, systemic racism, it's
It's
access,
systemic racism.
it's
Right.
all of the things. The root, I
All
think
the
the root
things.
cause is all of the things.
Right.
Um, and they all impact us, everyone. I'm thinking about like this year, because we're in an election. I was going to say we're going into an election year because that sounds like a thing, but we're in an election
Okay.
year. I know, like we're going into an election year. You hear the sound bites, but we're actually in an election year. And I know people are often like, honestly, I completely have I have fatigue around elections, and I don't know how. Well, I do know how, but I have fatigue around it, even though they're like it's like 4 years in between. I'm like, oh, we're here again. Like, oh, like there's got to be something better out here. There's got to be a better process.
Right.
But now I'm like, okay, we're amping up, and then thinking about how all of the different elections, local and national,
Right.
all play a role
Effective.
and directly
Mhm.
impact our lives.
Mhm. Right.
I'm thinking about the Dobbs decision and where they rolled back protections for abortion care. I'm thinking about all of the other decisions that have been impacted or taken to the Supreme Court level. I'm thinking about affirmative action, right? I'm thinking about everything seems to be up for like almost up on the chopping block.
Right.
So as much as I feel fatigue about moving forward and being in an election year, I just have to I have to I have to hope that and maintain for my community, for my children, that something better is coming right on the other side of that. And I think back to what Dr. Jamila Parrott, who was a keynote speaker at Black Girl Health Con, said, and her conversation about what do you do when like a system isn't for you, like what do we do until we get to the other side. And she was basically like, we work, we work,
Work.
we work. And that's what I plan on doing. That's what I'm hoping for all of our communities, that we will continue to work and continue to hold ourselves with care, and support each other. And I promise you, I'm so serious. If you do not, if you never have had a negative interaction, and I know that's really, really probably far fetched, if you never had a negative interaction within healthcare, or heard the horror story of a family member or somebody close to you being impacted or not believed, there will come a time when you do. And you're going to want to have tools in your toolbox of how to navigate and support them in those moments. Because we often never think, I think we often get very arrogant and think it will never happen to us. Oh, I do all the things. I take my vitamin C,
I
right?
go to
I
the doctor every
I
year. I
take
get all
my
my
vitamins.
checkups,
I do. Yeah, yeah, yeah.
all
you
the
know,
things.
you know what I mean? I have a great
Right.
relationship. Um,
Yeah.
but you're essentially trusting someone with your life, and you also need to trust that you know yourself, right? In those spaces, you do not always just have to take what is given to you. You are also an expert. I'm going to say that again. Say it again. You're also an expert. And we need to trust ourselves and really build those connections and relationships. Um, One thing that also makes me think of, if you have not heard of it or looked it up, look up the Earth app. This is an app. They dropped the B, the B in birth. I'm gonna put it in the chat. It's called the Earth app. It is a app where it's essentially like a referral system, and people, black and brown people, are able to go in and actually leave.
You disappeared. You went off. Oh, please.
I don't know what happened,
Technical
but
difficulties. You went out for a second.
I don't know what happened. But anyway, I'm back.
You can go. You dropped off at. You can
Oh, I'm
go
not back.
on.
I'm not back. I can see myself. Can you see me or no?
Yeah, I can hear you too.
Oh, you can see me though, right?
Yes.
Okay, cool. But if you have not, if you not have not heard of it, it's the Earth app. It is an amazing app where you can go on and leave reviews, from like, I believe, for providers. Um, I think it is definitely a game changer. I think that we need to continue to build resources and things like that so that we can be in community and conversation and really hold space for each other, and also feel really, really comfortable pushing back against these larger health systems and status quos, because I love y'all, and I want us all to be here. So, and
We
be, and
all want to
all,
win.
be believed. Be
Yeah,
believed
we
is the
want to
main.
be believed. We want you all to win, and that's a segue into Can you give us a little bit more about the network that's going to be connected to the Black Girl Health Collective.org? Can you give us a little bit about that so that that is also going to be a resource? Would that be accurate?
Yes. So if you have been sleuthing on our website, you may have noticed there is a member login section. And that is going to be our space where we have built out a network. And essentially, what it is a network where there will be community spaces for different topics and different subjects. And you can feel free to join those feeds. It's like kind of like a social network or community forum. So some of the spaces that I can think off the top of my head that are built out is just like our main Black Girl Health Collective feed where we'll be posting information, like resources. And then there will also be a feed for, we haven't nailed down the name yet, but if you went to the Lioness Club maturing in blackness or 40/40 club, we haven't nailed down the name for that, but that will also be a space. There'll also be a space for people that are interested in family planning, those who may be looking for support while you're struggling with stress and juggling it all, mental health resources. And then there will also be you'll have first access to Black Girl Health Collective resources, anything that we put out, and also all of our events and our different sessions with different people doing amazing things. So
Now,
that means that
I,
you'll. Hmm?
I'm kind of partial. So I just have to add my own little plug in. What I want you all to understand, if you haven't already understood, is that Black Girl Health Collective is a space, a movement, a community, an organization to help push the narrative and push community towards a better health system for women of color, Black and brown women, and women of color. And I want you to understand, yes, I am partial, yes, but I will honestly say this, that if I were not connected in the way that I'm connected in this work and in this space, I would say that this is well overdue and it's about time because it's something that's needed. And I think that if I had not had the health experience that I had with an illness, having never been ill to that degree, um, I would want to know more and be connected, but I'm partial. But again, I think it is imperative. I can't stress that enough. It is imperative that you become a part of this so that you're in the know because we have health insurances, we have car insurances, we have home insurances, all in place in case of. Why not have something like Black Girl Health Collective in case of? That's a resource for you. So we want you to be to be a part of that because whatever we've got, we're going to share it. We're not going to gatekeep over here. We want you to be great because we love you and we want us to move forward in greatness. That's all I got. But again, I'm partial, but it is important. Very important.
It is. It is. It's important for you. It's important for your family. It's important for your kids, because we don't know. You don't know what you don't know, and you don't think you need something until you do.
Right.
Uh, so make sure you're plugged in to our community. You signed up for and subscribed to our updates, and also like we do it in a way. Don't get it twisted. We like to have fun and we like to party. So trust me, it's not a boring time. You're gonna learn some things, but you're also gonna really build community and have a good time. So
And
make
that's
sure.
what Valentine's Day is about. Building community, get some information in your hand, build community, have a good time, and look cute doing it.
I
That's what it's
mean,
all
yeah,
about.
yes. So make sure that you're signed up for updates, and subscribe to us, to our website and our newsletter. all the things. And stay tuned. Make sure you join us next Tuesday at the Founders Table, we'll be talking to Shanae Darby and Erica Allen, the founders of Do Care Doula Foundation and also Black Mothers in Power, to learn more about their journeys and what led them to the work. And I guess we'll see you next time at Where Health and Culture Meet.
We love
What'd
you,
you say?
and we thank you for joining us tonight. And again, share, like,
Oh yeah, and
subscribe,
share
and
this. Please
share.
like, subscribe, and share. We're on like all the platforms. Yeah, that's the thing.
So yeah, share it all. And again, it's not it's not just one age group. It's all. It's all. It's everybody. Lottie but the body, Lottie Dottie and everybody. It's inclusive
Listen,
of all. So
it's
that's what
every
we want you to understand.
yes. All right. So see you all next week.
Thanks, guys.
Bye.
Bye.